welcome back to another episode of the Hard Money Talk Show. Today, we're going to be talking about something that plagues 1 in 3 Americans, and 1 in 5 Americans actually have this in collections. What we're talking about today is medical debt, and this is a very hard money conversation because 33% of Americans have this, and it's not something that we can really control. How can you control when you're going to get sick and go into debt from that? And the prices are outrageous. So I have brought on one of the top experts in medical debt, an author, to talk to us and break it down exactly how you can protect yourself about getting into medical debt, but then also how to negotiate your way out of medical debt up to 85%. So let's go and hop into the interview with Marshall. All right, Marshall, thank you so much for being on the show today. I'm glad to have you here. And thanks for just coming on and sharing your knowledge with us about, medical expenses and healthcare, because it's a big, hot topic. I know a lot of people that come through my community and my courses are huge when a lot of people are in medical debt. And it's one of those things that once you get in, you just don't know how to get out. So talk to me and you explain a little bit about how you got into this.
Well, thank you first for having me here. Americans repeatedly say that the high cost of healthcare is their number one financial concern. And so it's extremely common. So anybody who's thinking about their money should be thinking about their healthcare. I know those two aren't always obviously connected, but I got into this as a journalist back in 2006. I had an editor ask me to cover healthcare. I actually did not think I would be as interested in it as I ended up being. And the reason that I was so interested in it is I found that the two things people probably care about the most in their lives are just their health, their physical well-being, and their money. And when I started covering healthcare from the point of view of the patients, I found out right away that people are too often not getting high quality healthcare. So sometimes they're even being harmed while undergoing healthcare. And then number two, they're almost always being overcharged. One thing that's common in the United States, our healthcare system is overpriced, and there's not any justification for the high prices. And so I try and show people how to avoid the overpriced healthcare. And then if you've been overbilled or erroneously billed, how do you identify that problem and then contest it and then renegotiate a better bill?
That part is huge because I think people get a bill and they're just like, oh no, I got to pay this. Right. And it's like, no.
Yeah, that's right. I called my book Never Pay the First Bill, not saying that you should never pay your bills. Obviously, we should pay a fair price for the services that we receive. But unfortunately, many healthcare bills have errors in them. They are often filled with charges for things that did not actually occur. And so you have to get an itemized bill, which is just like a detailed description of each service that you're being charged for. Hospitals won't typically give those to you unless you ask for them. So get an itemized bill and then check it and make sure, just like you check your receipt at a grocery store, check it and make sure that those charges are for things that actually occurred. Believe it or not, it happens all the time that people find things that didn't actually happen. And then check the prices. So make sure it's accurate, make sure it's fairly priced. And now there are more places than ever where we can peek and see what prices actually should be for the services we receive. And often the prices are way higher than they should be.
Okay, so you say we can peek and see. Where are some places where we can peek and see what these prices should be?
Yeah, the biggest breakthrough, I think, is hospital websites. Hospitals are now required by the federal government to post their prices online for their services. And they have to post their prices. They have to post cash prices, and they have to post the prices that they've negotiated with every major insurance carrier in their market. So in other words, if you're covered by United Healthcare and you receive a service at a hospital, you should be able to go on that hospital website and see what the United Healthcare rate is for that particular service. Now, here's the crazy thing. Often the cash price is cheaper than the insurance company's negotiated discount. It's ridiculous because insurance companies are supposed to get us better deals, but often they don't. Or you might see that your United Healthcare price is 2 or 3 times more than the Blue Cross price or the Cigna price. And so my position is, as consumers and as patients, we should not be required to pay more than other patients pay for the exact same services. I mean, you wouldn't go into McDonald's and pay more for a burger depending on the type of healthcare coverage you have, right? So it's not a fair thing, but it's the way the system has been set up. Patients haven't known it in the past, but when you check those prices on hospital websites, again, that's a federal regulation that they post them. You can get the prices. Another website, I just want to give you one more resource, is called fairhealthconsumer.org. Check that website. You can get the billing codes for the services you need or the services you received. Again, that should be on the itemized bill, or your insurance company can give you those codes. Then you can look up the codes to see if they're accurate, and then put them into fairhealthconsumer.org and see what a fair price is in your community for that service.
That's a great resource. And we'll put that in the show notes so people can find that. So one thing that you mentioned I want to go back to is equitable healthcare, right? So I did a little experiment because I'm a self-pay because I do like a health sharing ministry.
Yeah.
So I go to this one dentist, and I've been going to him for like 20 years, and he's a great dentist, and I pay for him, And so I was like, you know what? I want to go to a dental clinic and see what the difference is in care that people with maybe, Medicaid are going to. And so I booked an appointment, like a new patient appointment at this Medicaid clinic. And so when I go to my regular dentist, it's like an hour-long appointment, right? They're checking my teeth. The cleaning takes about 40 minutes. It takes a long time. And the cleaning was literally 10 minutes. 10 minutes. That was it. And I was like, are you done? They're like, yep. I'm like, that's it. That's the cleaning. And they just get people in and I was thinking to myself, like, this is insane. Like, yes, you think you're going to a dentist and like, great, you have dental coverage in your insurance, but you're not getting the same quality of care because maybe you don't have enough money. So when that popped up to you, I thought to myself, like, we got to talk about that because that's a huge deal depending on where you live in the country, how much money you make, what type of insurance you have, what type of insurance you can afford. So talk about that a little bit.
So I had a source who was a former hospital CEO, and he liked to talk about checking a patient's insurance coverage. He called it the biopsy of the wallet. In other words, they do treat people differently depending on the type of coverage that you have and depending on how much your coverage pays. The catch is that now we as the patients share such a high percentage of the cost of the coverage. Like, we might be on a high deductible health plan, right? Many people are paying the first $3,000, $5,000, even $10,000 a year of their medical bills. And that's on top of the premiums that they're paying every month for their insurance. So now, if your insurance company pays more, well, the hospital or the dental office, they might love that. Great, they're getting paid more. But now if you share a larger portion of that payment, then you also are paying more. And this is contributing to our massive problem with medical debt. But you've hit on something really important, and that is that these type of inequities are all over our healthcare system. And really, you're talking about an access to care issue. So Medicaid patients at this particular clinic, they did get some cleaning, right? They got a 10-minute cleaning, but they didn't get the full service and the extensive cleaning that you were getting at your other place, other dental office when you were paying out of pocket or with your health sharing plan. This is a major problem. And in fact, there are lots of places that won't even take Medicaid at all. Mm-hmm. So what do those Medicaid patients do? Or we see this a lot with mental health services. There are mental health parity laws that require insurance companies to pay for mental health services in the exact same way they pay for physical health services. But that has not been the case in our healthcare system. And anybody who's tried to get mental health care can tell you that it is very difficult to find a therapist or to find a counselor who takes your insurance.
Yep.
And that's Medicaid, that's Medicare, that's all different types of insurance plans. Many of them are cash pay. And so we have this massive problem in our country. It's overpriced for working Americans and people who are paying the bills. In other cases, we have about 30 million people who are uninsured. And yet we pay more for healthcare than the citizens of any other country in the world.
It's insane. And I think about like my background. So I was a drug and alcohol counselor for years before I had my kids. So when we would go and try and get people into inpatient treatment, we would have to call the inpatient program, give them their insurance information. And then a lot of times they'd say, okay, well, he has 7 days. And it's like, how the heck is somebody supposed to detox from heroin in 7 days? And then you're just going to leave them out on the street and they don't have money to pay for the rest of it. You know, they just lost their job and they were put on Medicaid to even get into this. But the people that got better rehabs were people that were on Medicaid. In this situation, private insurance companies paid barely anything for rehabilitation for drug and alcohol. I mean, you had to find these ritzy rehab places to take any sort of private insurance. And it made it very, very difficult for people to get any sort of good quality care. And then they would get there and then halfway through their insurance would run out and they'd literally get kicked out of treatment.
And the same thing would not necessarily happen in most cases if someone had a heart attack or kidney failure or something like that, where they were in the ICU, or COVID, right? And this is the type of inequity and unfair type of unjust situation that is found throughout our healthcare system. We really have a healthcare system where a lot of large companies and corporations, even nonprofits and for-profits, are finding ways to make money in the healthcare system. Now, their argument would be, well, we just have to keep the lights on. You know, we have to make sure that we're getting paid and well compensated for the care we provide. Otherwise, we can't provide any care, right? That would be their argument. But there is so much waste and so much overspending and so much fraud and so much administrative complexity and claims payment complexity in our system. I spent an entire year doing nothing but stories about all the wasted healthcare spending we have in the United States. We waste, according to a 2012 study by the Institute of Medicine, at the time, we were wasting about $765 billion a year on healthcare. About 25% of the total was wasted on those problems like high prices or the complex way that we pay claims or overtreatment, right? A lot of things that are provided are not things people actually need, but they make the industry a lot of money. And so if we could find ways to reduce this waste, all of our healthcare costs would go down. People would be able to get the care they need for mental health or dental cleanings. You know, people wouldn't be uninsured. But unfortunately, these imbalances and inequities are really built into our healthcare system. And I've come to a position where this may be a provocative way to say it, but I think that our system is in many cases built to exploit our sickness for profit. And I hate to say that because there are a lot of great clinicians out there working in our system. They generally are not the problem.
Mm-hmm.
It's the middlemen, it's the insurance companies, it's the pharmaceutical companies, it's the pharmacy benefit managers. It's all these other types of middlemen who have inserted themselves between the clinicians and the patients, and they're extracting money from the system and adding cost without adding value.
Yeah.
And that's really a problem for patients. And that's why I wrote my book, because we're not seeing politicians solve this problem. Mm-hmm. You know, Republicans and Democrats have had plenty of time. They've had decades to come up with meaningful policy solutions, and they haven't done it. And so we're left as uninsured, insured, working Americans, Medicaid, we're left in a position where we have to navigate this system that is fraught with financial pitfalls that could cost us hundreds or thousands of dollars more than we should be paying. Mm-hmm. And so every single time we get healthcare, not only do we have to worry about our physical health, we have to worry about our financial health. And
it's so true.
It's a tragic situation. In a functional world, I would not have written my book. But unfortunately, we have an extremely dysfunctional healthcare system. And so there's a great need for the book.
One of the things that I want to talk about is because we had somebody on earlier who was talking about medical debt. One of the things that I deal with as a financial coach is people coming to me, $20,000, $30,000, $40,000 in medical debt, because maybe they had a high deductible, right? And then something happened and they had to pay $10,000 out of pocket. Maybe they didn't have health insurance. Maybe one of their kids got sick. Maybe one of their kids had to go to 2, 3 rehabs. I know my brother was a drug addict, and he unfortunately passed away from his addiction, but my parents had to spend so much money paying for his rehabs, because once you go 1 or 2 times, like, you've used up your allowance and they won't pay anymore. So you can't put a price tag on somebody's life and say, I'm sorry, you can't go to, cancer treatments or this or that. So like, how do we navigate this? Like, let's start first with, how do we protect ourselves from getting into medical debt? And then let's shift gears to, what do we do if we find ourselves in medical debt? How can we negotiate that? Let's go that direction.
Okay, let's start with how to avoid it in the first place. I think, again, this is an extremely unfair situation that people are put in. So I don't want to minimize that. But at the same time, we're up against, the best word I can use to describe the financial side of our healthcare system is predatory. It is a predatory healthcare system. Again, this has nothing to do with the great doctors and nurses and physical therapists and counselors who are providing people the care that they need. We're talking about the way the insurance industry, the billing departments of hospital, the revenue cycle managers is what the term is for it. They are looking, unfortunately, to extract as much money as they can from the patient. And there is no mercy. I mean, it is a ruthless system. So let me just get that as a caveat, okay? But we have to change the way we view the system as patients. We have to recognize that financially, we could get in a lot of trouble here if we're not careful and if we're not savvy. And so we have to learn a few principles that we can apply to protect ourselves. So principle number one, if you're trying to avoid going into debt for healthcare, avoid getting care that you don't need. Now that sounds really hard, right? Because you go, well, how am I supposed to know? I'm the patient. But when we understand the incentive structure for a lot of healthcare, usually it's called fee for service. In other words, they only get paid if they do something. So if you go to a doctor and say, hey, doctor, do I need this operation? And that doctor's payment is based on whether or not he or she does that particular operation. That doctor is a human being who's motivated, just like any of us are, by financial incentives. They might lean toward giving you that treatment, that drug, that test, whether you actually need it or not. So if you can, get second opinions. Make sure that you don't just, if you have the time and the ability to get a second opinion, don't go undertake a major medical procedure or an expensive medical procedure until you have gotten a second opinion and researched it. Again, about 25% of all healthcare is considered wasted. It's considered unnecessary. And so things like tests, let's say it's a discretionary test. They say, well, I don't know quite what's going on. I'd like to run some tests. I'd like to have you get an MRI. I'd like to have you get a CT scan. I'd like to put you on a drug and see how you respond. Well, I think a key question to ask to avoid unnecessary care is, okay, you want to give me an MRI. What happens if we wait? If we don't get the MRI right now, am I going to collapse and die when I walk out of the office here? Or could we take a minute, take a breath, pause, and delay it for now? Take a minute. Watchful waiting is the term that they'll often use for this. And so it might be a certain type of a screening test. It might be a medication. It might be an imaging test. It might be a procedure. The question I think you should always ask is, what happens if we wait? That reframes the conversation. So now you and your clinician can discuss the option of not taking action and see what might happen. So that's one way, avoid unnecessary care.
Let me go back to that, because I think this is really important, because I've been on a health sharing ministry for like 7 years. And that's one of the things that that's one of the things that I learned through being on one of those, is to be educated and to ask questions and to stand up for my own rights. Because when you're on insurance, you just like, yep, just whatever, bill the insurance company, and then you get a bill. But when you're paying for it yourself, you make a lot more educated decisions. So it's like, okay, what are you putting on that blood slip? Because I'm going to have to pay for everything that you're testing. Like, do you really need to test me for all the hepatitis when I don't have any, and you know that?
That's right.
Like, and I'm not going to pay for that.
Yeah, I've seen cases where they run pregnancy tests on women who are in their 80s.
And
do you need to do the pregnancy test?
No, you don't. And case in point, like I was at, and this might be too much information, but I'm just going to share it because this is like the Hard Money Talk show and I'm authentic.
Let it out there.
Yeah. So I went to my like yearly OBGYN appointment the other day, and my doctor's trying to like convince me to get my tubes tied. And I'm like, I'm single. Like, why do I need a surgery? And he's convincing me. And then I go to pick up my medication, and he wrote this like big script for birth control for me. And I'm like, I'm single. Like, why are you feeding me this stuff? And I don't have insurance. Like, what, they just assume that you have insurance. So they're just trying to get you to like, they're making money. I'm like, he's got to be making money somehow off of this, like hysterectomy or like tubal surgery, because he was pushing it so hard. And I was like, he's got to be getting paid somehow through this.
You don't want to feel when you go to your physician like you've showed up at the used car lot.
That's how I felt. I was like, this is really weird. Like my female, you know what I mean?
I'll give you another example. My wife has encountered this every time she's gone for her annual appointments with her OB. She is not in a category to get a mammogram. So if you look at the guidelines it's called the U.S. Preventive Services Task Force. That task force is a group of volunteer experts. They study all the most reliable research about preventive screenings like mammograms, prostate exams, and other types of these screening tests. And then they make recommendations about who really benefits from these tests. Well, for my wife, when she was in her 40s, she actually just turned 50. So now with the U.S. Preventive Services Task Force, they would recommend that she gets a mammogram. But for women in their 40s or in their 30s who are not at high risk of breast cancer, they actually do not recommend getting mammograms. And so for any type of screening test, consult the independent scientific evidence that's provided by the U.S. Preventive Services Task Force. Make sure that okay, they're going to recommend that I get a mammogram. Well, if you get a mammogram and you didn't really need one, there can be harm there. There can be false positives that come with mammograms that lead to treatment, that lead to certainly a lot of stress if you're told that you have cancer and you don't. And so it can also lead to physical harm and expense, and all of that will be billed to you. So you're on a health sharing plan, so you really feel the cost yourself. But even people who are on insurance plans, even people with what they like to call rich healthcare benefits, right?
Right.
Really plush health insurance that pays for everything. We are still paying for all that. You don't feel it directly because it's not coming out of your wallet at the time of service. But that's why healthcare costs keep going up every year. So if you're a working American, look back, if you get your benefits through your employer, look back year after year and look at those costs go up 5, 10, 15% every year. It's an ongoing march of increased costs. And that's because we are paying too much for healthcare and we're getting too much healthcare that we don't need.
Yep, I totally agree with that. So you said part one of that, right? What is, if we go on to
part one, to avoid care you don't need. Number two, avoid overpaying for the care that you do need. So let's say people don't really realize how crazy the price variation is in healthcare. But let's say you need a knee replacement. You could pay $20,000 at one hospital in town, and you could pay $80,000 at another hospital in the same town. You're not getting more for your money. You're not getting a better knee replacement. Most healthcare that gets provided in the United States is standardized. When they do a blood test or when they do a knee replacement, these are procedures that are done tens of hundreds of thousands, maybe even millions of times a year in this country. It's not like they're making it up individually every single time they do it. And so usually you can get a high quality of healthcare while paying a lot less for it. And so you just have to know where to look. And so if it's prescription drugs, check out a site called GoodRx.
Yep, I love that.
GoodRx, right? So especially if you need an individual prescription, getting it at GoodRx might be a good option for you. I recommended a membership program at a pharmacy in Tennessee called Good Shepherd Pharmacy. They have a membership plan where you can pay a small monthly fee and get the generic drugs that you need. And again, generic drugs are not worse than brand name drugs. It's actually the same drug, the same formulation. It's just not patent protected anymore. And so it's much, much less expensive. Sometimes even, you think that your $10 copay, when you go to the pharmacy counter and pay for a drug, you're like, oh, I only have to pay $10 and I get the drug. Well, a lot of times that drug might only cost $3, but you're overpaying by $7 every time you get it. And you think you're getting a good deal because your insurance plan has told you that you are. So you want to price check. And you can price check by calling multiple pharmacies if you need a drug, looking for membership plans that might be available. You can also price check by now looking at hospital websites, check and see what the prices are there. Look at fairhealthconsumer.org. Again, they'll give you the average price that's being paid by insurance companies in your community, but make sure you're not overpaying. And if you can get the price up front and then go to the best price provider, if you can't, after you get the bill, check those prices and see if you've been overcharged. And if you've been overcharged, contest it. So maybe a third principle is everything is negotiable in healthcare. They're making up these prices to begin with. So I don't know if your listeners really understand just how crazy the healthcare billing system is, but the price that you pay is typically a discounted price off of the initial charges. So the initial charges are some high price that is frankly made up. It's not based in reality. And then they'll negotiate, an insurance company will negotiate a discount off of those charges. And so that way the insurance company can say, oh, we got you a discount of 60% off of the charges. And the hospital can say, oh, we gave you a discount of 60%. But if you're not insured, you're a cash pay patient, you're on a health sharing plan, you don't want to go in there and pay that sticker price. You don't want to go in there and pay those billed charges. Say, I need a negotiated discounted price. And my argument is, even if you're an insured patient, if you know that Medicare paid $200 for the procedure and you were charged $1,000, well, my argument is, I don't feel like I should have to pay more than any other patient would pay for the exact same service. Please do not discriminate against me because of my type of health insurance. Give me the same price that the Medicare patient gets, or the Blue Cross patient, or the cash paying patient, but don't penalize me because I'm insured.
If you started 2022 with more debt than you'd like to have, you're not alone. Debt.com is here to help. Whether you still have holiday credit card debt to pay off or student loan payments are starting to build up again, maybe you even have debt collectors that are hounding you for payments you just can't make. The experts at Debt.com can help. Finally, one website can help you solve your debt problems. Credit cards, back taxes, student loans, medical debt, collections, you name it, Debt.com can help you solve it. And they do it with no judgments, because they understand that when people end up in debt, it's usually for things outside their control, like job loss or divorce or some other hardship. So if you're in debt, visit laurengrutman.com/debt to get the relief you need, or call 888-431-2044 to get a free consultation with a debt relief specialist. Find solutions to get out of debt, fix your credit, and get on the path to achieving your financial goals. When life happens, visit Debt.com. That's a good script that somebody could write down when they're making phone calls, right, to these hospitals. Because I think, so what I've seen over the years is people get the bills, they ignore them because they can't pay them.
That's right.
So then they start getting they go into collections, and at that time, it's out. Then they try to call the hospital again. The hospital's like, we already turned them over. We can't do anything about it. So how do they stop them by going into collections. So the first step, my guess, is to ask for the itemized bill, right? To look it over, look at the code, go to the website. It was at Fairtrade, fairhealthconsumer.org, and check to see, that you're paying a fair price for that. And then you can call is it the billing department at the hospital?
Yes, call the billing department.
Mm-hmm. And then try and
negotiate a fair price. And in my book, I actually have a chapter. If they refuse to negotiate and give you a fair price, in many cases, you can sue them in small claims court.
Okay.
And so this is another tactic that is to protect consumers. Our country has set up the small claims court system, and it's really designed, you don't need an attorney. And when you're being preyed upon by a business or a powerful individual, you can sue them in small claims court to protect yourself. And so I'm just helping a woman do that right now, where a hospital system has overcharged her for a scan, like a CT scan, and they've refused to bring the price down. And so she is now suing them in small claims court. I have letters in my book that are templates people can use to send to a hospital or a doctor before you sue them, because you want to do everything you can to avoid the lawsuit. But if you have to, when you file that case against them, so in this case, she could have gotten a CT scan for a few $100s. They ended up charging her about $1,500. So she wants to pay a fair price, but she doesn't want to overpay for this particular scan. So they haven't agreed to negotiate the price or reduce the price. So you name the entity that's suing you, that's billing you. You name them as the defendant. And in this case, it's something like a breach of contract. I mean, when they don't give you a price up front, in our Uniform Commercial Code, which is the laws that govern commercial transactions in this country, they have a term called the open price term. And your listeners can Google that. Google the open price term. And what that says is, if you're not given a price at the beginning of a consumer transaction, like to use the McDonald's comparison, you go to McDonald's, the price is on the menu, you agree to pay the price, you pay the price. That's a fair consumer transaction. The open price term says, if no price is given up front, then it's assumed that the price that you get will be a fair price that is set in good faith. And charging $1,500 for a CT scan that should cost $300 is not a fair price, and it's not set in good faith. And so they aren't just allowed under our consumer laws to bill us whatever they want. And yet we're having people sent to collections every day in this country based on these exorbitant and unfair bills.
Yep, I totally agree with that. And I think the tricky thing is getting people to understand that anything is negotiable, and even, I've worked with people as they have collection bills coming in, and they're like, we have collection bills. And I'm like, okay. So when they come in, you say, okay, well, I can give you, let's say the bill is $600. I can give you $200 right now. Let's just call it a day. I can give it $200 right now. And then those are negotiable, like nothing is set in stone when it comes to that.
This is sort of the dark hope for people who have medical debt in collections. Your leverage to negotiate is never better than when you have the bill collector calling, because at that point, they've basically given up on you.
Right.
They assume they're not going to get anything from you.
Yep.
So let's just say you owe them $1,000. They think they might get nothing from you. So do not ever assume that you're going to have to pay that full $1,000. You do want to negotiate your way out of that. But I talked to one expert who I quoted in my book. His name is Jerry Ashton, and he's the founder of the charity called RIP Medical Debt. And he spent decades as a bill collector. And so I asked Jerry, I said, how negotiable is it? What's the target that people should go for? He said that he thinks that you could get an 85% discount off of the debt that you have in collections. That's a massive discount. And the reason he came to that is because what happens with medical debt that's in collections is there's a whole market of debt buyers purchasing these debts and then pursuing the consumer to get the debt repaid. They only pay a few cents on the dollar for those debts. So let's say the debt is $1,000. They might buy that debt for $30 or $50, like again, 3 to 5%. So if you give them $150, which is 15% of that $1,000, you've just given them a nice profit on the debt that they purchased. So it is very depressing to have medical debt, and even more depressing if you have medical debt in collections. But you do have better leverage when you're in that situation. The one caveat, oh, sorry, go ahead.
No, you go ahead, finish up your thought.
Well, I was going to say the one caveat is do not ever make a deal with a debt collector that you can't abide by. Because let's say you agree to get the debt reduced and you restructure the payment plan, say, and you default on one of those payments, that debt is going to go right back up to the original amount that you owed. So you're going to be back behind the 8 ball if that happens.
I actually listened to a podcast from a lady who used to be a debt collector. And she was talking about how her whole job was based on finding people's pain points and finding people's weak spots and knowing what made them hurt. And it was a whole manipulation thing. So her whole training was based on, okay, this is what I know that this lady, her son is a drug addict. And if I call her, I'm going to really need to talk about that, about like your son, you don't want him to die. You need to free this up so that your son doesn't die, and like really use those things against them. And shame and embarrassment and false promises of like, I'm going to show up at your house. Those are they can't do that.
So this is another key thing I want to talk about related to medical debt. We need to eliminate the stigma that's associated with medical debt. Because first of all, if you have medical debt or medical debt in collections, you didn't accrue this debt because of some reckless decision you made or some irresponsible choice. You didn't go on some vacation you couldn't pay for, buy some big screen TV or some car, and then default on that. You or your child or your loved one got sick and had to go to a hospital or a doctor and probably got overpriced and overcharged. You might have gotten treatment you didn't even need, and now you're on the hook for it. And so this is a result of our broken healthcare system. This is not caused by individual patients being irresponsible. So that's one reason we need to eliminate the shame and the stigma that goes with medical debt. But another reason we need to eliminate it is that usually there are stigmas around things that not everyone is experiencing. But did you know that 1 out of every 3 people has medical debt? And 1 out of every 5 people has medical debt that's in collections. So if it hasn't happened to you, it has certainly happened to people it's happened to your loved ones. This is a blight. This is a problem that is being shouldered by the American people. So if a debt collector is going to try and make you feel bad because you have medical debt in collections, you should ask them, hey, do you have any medical debt in collections? Chances are good that they do. Or ask them, have you ever known anyone else with medical debt in collections? Chances are very good that they do. So this is not something where we should feel shame about it. And don't let them use that as leverage, because they might try and do that.
It's so true. And I think that's, when I was listening to that podcast, I was thinking, oh my gosh, these people really do use that to get, because they get a percentage of whatever debt they get paid off. And they have, they have a board up on the wall of how much debt gets paid off and all of that. But I think that when you understand that it's all negotiable, 85%, I think that that's a good number for people to try to hit, right? If it's $1,000, you know what? 85%, that's the number I'm going to try and hit and try and negotiate this down.
It is. And as you already mentioned, you should get a discount if you pay it off as a lump sum. So you want a better deal if you're going to pay it off all at once. And then another tip is, this sounds kind of crazy, but try and be friendly with your debt collector. I don't know, when you're negotiating, it generally does not do any good to turn it into a hostile confrontation. Use humor, be good-natured, get to know the person, let them get to know you. Say, hey, I'm Lauren, I've got 4 kids. I'm working my way through life just like anyone is, or like in my case, hey, I'm Marshall. I've got 3 kids. I've got 2 of them in college, and you would not believe the tuition bills that are hitting my family on a monthly basis. I wish I could give you this money. I really want to be able to do that, but I know that I can't enter into an agreement with you that I can't abide by. And so I have nothing to pay you. And so if you want me to pay you, we're going to have to come up with an agreement that works well for both of us. We're going to have, what could it be? What's the discount that you could give me where you would still be able to go back to your boss and you'd be a winner? You'd get that gold star at the end of the week at your meeting with your company, where they would applaud you for collecting this debt. Just tell me, what's that number? And maybe we could get to it. But if we can't get to a deep, deep discount, then I'm afraid you're just going to not be able to get anything.
And, it was interesting listening, and I'll link the podcast episode that I'm talking about so people can listen to it. But it was interesting. It was interesting listening to her as well, because she said the people that were nice to her, she really could tell that like they really didn't have the money. So she would let them off the hook and call them again next month. And she would let him off the hook and call him again the next month. And she said, those are the people. She said there was one lady that had a ton of debt. And she was like, listen, like I'm dying of cancer, like I can't pay it and I'm dying. So like, but this lady still had to call her every single month. And she called her, I think 9 months in a row, until she knew that she would fall off the call list and they were just going to forgive the debt, because that's what happens. And so for this lady, she just called her and she knew she wasn't going to pay, but she checked in on her just to see how she was doing. And, it almost became a friendship. But she's like, the people, like you can tell who has the money to pay and won't. And if you're just open and honest with them about this is what's going on and I'm really struggling, like I love how you said, like, what is a good agreement that you can take back to your boss and get a gold star, but that it's going to help both of us win.
Yeah. And humanize the debt collector. Cause again, you might end up having an ongoing relationship with them, right? They might be calling you a lot. And again, we might want to cuss them out, right? We might want to, curse their children and the ground that they walk upon, right? But at the same time, it's not going to be fruitful to have that type of hostile relationship. It's not going to make the debt go away, and it's not going to motivate that person to give you a break and give you a better deal. So try that tactic.
Yep, I totally agree. Well, we're wrapping up our time here. Is there any other like last minute advice that you would recommend that we didn't cover?
A couple things. One, I would love for people, if they're interested, you can go to my website for more information. My website is marshallallen.com. And one thing I'm trying to do more and more of is share victory stories, because in a victory story just is a case where someone is able to save a lot of money on their healthcare without compromising the care that they need. And for example, I just talked to a woman the other day who saved $80 on a CT scan by paying the cash price instead of paying her insurance company's price. Now, $80, somebody might be like, well, that's no big deal, $80. But still, $80 might be a week of groceries for your family. $80 might be the Christmas tree that you want to buy for your family this year during the holidays. So $80 is a chunk of change, and there's no reason why we should overpay for the care that we need. And sometimes it's bigger money. Like I had my son go to an urgent care a couple years ago. They didn't run the bill through my insurance plan. They just sent it directly to me. I mean, they made it sound like I owed it, but they had never even submitted it to my insurance company. And that was a $250 bill. I was able to look at it, and then I could see that my insurance plan didn't pay anything. And so I called my insurance company and I confirmed that the claim never got submitted to them. I called the urgent care and I said, hey, it looks like you need to send this bill to my insurance plan. I caught that error in about 5 minutes and I saved $250. So sometimes it's difficult and you have to go to small claims court. You have to fight tooth and nail. You get sent to collections. It takes months. It can be really, really painful. But other times it can be really, really easy. So I'm trying to share these victory stories so that people can get motivated and they can see, oh, here are the tactics that we use. So I hope people will check out my book. It's a how-to guide. I hope people will subscribe to my newsletter. They can learn more and share these victory stories, and then share victory stories with me. If you have problems with your bills, you can contact me. And if you have victories, I want to hear them so I can share them with other people.
That's so awesome. And I appreciate you sharing your website and all of that. And I'll put all of that in the show notes. But I think that one of the biggest takeaways that people can take is that we can't be so trusting of the healthcare system. Unfortunately, we want to because we think they're doctors and all of that, but there's so many more hands in the game right now that we need to be educated consumers, because if we're not, we're going to lose. We're going to lose because they are bigger and faster. And so if we can be educated and we can read our bills and we can prepare ourselves ahead of time, we're not going to get into the mess. But I think that that's the big thing, is people just trust too blindly in the healthcare system of like, oh, well, they must have done that. They wouldn't do that. They're doctors. No, they do, and unfortunately you have to be an educated consumer. And I've learned that the hard way, being overbilled for things and being somebody who has to self-pay, being like, oh my goodness, like I did not need that. Nope, I don't need that, and doctors are kind of like shocked when you stand up for yourself, like I'm not going to need that. I'm not going to need that test. Well, it's I just want to make sure. Okay, well, I think I'm okay. I'm okay.
That's right.
And so you can make these decisions and it's okay. And I think that's right. That's the takeaway.
That's correct.
Yep. Well, I appreciate you coming on so much today. This was great. I think a lot of people will learn a lot about what goes on behind the scenes, but also, negotiating and what we can do to even like the scripts. Like I'm so excited to check out your book and see those scripts, because I think those are huge in teaching people how to be educated and negotiate. And even the websites that you mentioned, like I didn't know the second one that you talked about. So that's huge as well to find out those prices. So I appreciate you coming on the show today.
Thank you so much. It's my pleasure.
Thank you so much, Marshall, for being on the show. I hope all of you enjoyed this episode. And I really want you to check out the show notes. You can go to laurengrutman.com/podcast and check out the show notes and all of Marshall's information with his book and website. But I highly recommend that you go and check out the podcast and also join my community. If you have medical debt and you want to learn how to negotiate it, but also learn how to budget that debt to pay it off even faster, come and join my community where I help you walk you through that as well. So thank you for tuning in to this episode, and we'll see you next week. Bye.